And after that tragic mass shooting south of the border, Ottawa has now tabled new legislation which would crack down on gun ownership. Joining us live now is Julie Maggi, a co-founder of Canadian Doctors for Protection Against Guns, to share what the health sector has to say about this and has experienced amid the rise in gun violence. Good morning to you, Doctor.
Good morning. Thank you for having me today.
Thank you for joining. I just want to get your initial reaction here to the announcement, which you took in yourself there yesterday. What does this mean for you from your perspective, and is it enough?
So we at the Canadian Doctors for Protection from Guns have been calling for a national handgun ban since our inception in 2019, shortly after the Danforth shooting. So we're very pleased to see the provisions for limiting the sales, transfer of handguns in this legislation. And then, is it enough is a very good question. The problem of guns in Canada is a complex problem, and there's not going to be one, two, or three things that solve this problem. And so we think this is excellent progress that is consistent with public health and evidence-based measures, but there's more to do.
Let's talk about the more to do. If this was up to you, what would that more to do look like?
So part of the more to do, well, first of all, we need to see the actual legislation. So we haven't seen that yet. We have been told what's in it, but sometimes, the proof is in the details. So after we see those details, I think we will be able to comment on things like the red flag legislation that they've included. Is that enough? Will it be enough to curb harm in the community? And in truth, some of these things like red and yellow flag legislation are very complex, and they've been successful in many jurisdictions in the United States, but we don't yet have data here in Canada. So one of the important to-dos, I think, is to work towards developing a national research center for firearms safety and policy so that we can really start to understand some of these things in the Canadian context.
The organization that you are part of, as you said, the inception in 2019, for those who are not familiar with what happened along the Danforth in Toronto, this shooting, innocent victims, and sad situation that which we see all too often. As this organization with doctors, you don't often hear from, what you have to deal with on the other end and receiving patients and that trauma that is dealt with on that end as well. Can you take us into that?
Absolutely. First of all, our organization is made up of physicians and other healthcare providers from across the country and in many different specialties. So we have trauma surgeons and we have psychiatrists like myself, family physicians, and what happens when someone comes through the doors of the emergency room is something that most people don't know about. And this is part of why we felt, I think, a moral and ethical obligation to really inform the public of what happens. So it's not just like somebody's shot and then they're fine. If they're fortunate enough to survive, and we know that guns are amongst the most lethal weapons that we have, but if they're fortunate enough to survive, it often means multiple surgeries, physical rehabilitation, connection to a psychiatrist or mental health provider. And then it's not just the person, right? So we see family members. And so from having to tell family members that someone has died, right up until the family members and the community members who are affected emotionally by the injury or the death. So it really has far-reaching ripple effects.
Thank you for talking about that, because often, you hear it in the news, you see a headline, a number of people shot, and people just sort of leave it in that, compartmentalize that. The ripple effect is so massive that to get a glimpse of what, you on the other end having to speak to family members or community members for years to come, potentially even a lifetime, because these are images and experiences that last with families and communities. So it is really something that we need to not only think about, but of course take action on. So next steps, as mentioned, Dr. Maggi, is that you need to look at that legislation. Where does your group come into play with consultation?
So we will be happy to meet with any of the ministers, obviously, who are going to be voting on this legislation. We would be pleased, and I hope we'll have the opportunity to present at the Public Safety Committee as the legislation is reviewed. And we have a large group of us who have been for years now reviewing the medical literature, reviewing the policy literature, and really trying to wrap our heads around what can be helpful. And so we're happy to be in the background to advise on that and talk those things through with the government.
Dr. Julie Maggi, appreciate you taking the time with us today on this very important issue. Much appreciated.